Hi, good evening, everyone. Thank you so much. Thank you so much for being here tonight. And I know that you will not be disappointed. This hospital project is extremely exciting. We've all been waiting for it for so long, and we all deserve it. So I want to recognize that we have Regional Councillor Gino Rosati here. Thank you so much for joining us. Really appreciate it. He's been hugely supportive throughout the process for this new hospital. And you're not here for me tonight. You're really here for the President and CEO of Mackenzie Health, Altaf Station Walla, who will walk you through the entire, video and explain to you, we'll show you the designs. You'll be able to see what this hospital is going to look like from the inside and out. And I believe tonight you're also going to talk about smart hospital. So that's really important because that really changes how business is done and how you as a patient is looked after. So I'll test you all later to see how much of the smart hospital concept you remember, okay? So I can only remember 4 things, but there's lots more. So thank you again for being here and enjoy your evening.
Thank you, Councillor, and we really benefited from Marilyn's support. I think this is the 3rd or 4th session we've done with Ward 1 individuals, and obviously keeping you informed as to what's going on at Mackenzie Health, and more importantly, with the progress of Mackenzie Vaughan Hospital. With me today is he's a Vice President at Fundraising Group, and they are responsible for delivering this project. And Stuart LG is a Senior Principal at Stantec, who is designing the new hospital. So they will assist me in this presentation and hopefully wow you with some of the images of what we're going to create. So first, a little bit about Mackenzie Health. We used to be called York Central Hospital about 4 years ago. We rebranded the organization really to reflect the fact that we have a second hospital coming online in the near future. And we engaged about 500 residents in the renaming, and the clear thing that came across from both communities in Richmond and Vaughan, they said, please ensure that both hospitals are called a hospital. We don't want it to be a campus, we don't want it to be a site, we want it to be a hospital. So that's where the name Mackenzie Richmond Hill Hospital and Mackenzie Vaughan Hospital, as the names for both hospitals came to be. And the organization that runs both hospitals is Mackenzie Health. But the other thing to keep in mind is that we have a number of ambulatory care locations throughout the community that will continue even when the Mackenzie Vaughan Hospital goes online. So in Vaughan, for example, to your left we have a location where we provide diabetes education, cardiac rehab. We have a number of services like finance and foundation in those offices. To the right is another location where we have a number of outpatient dialysis stations, and actually run an urgent care center 6 hours a day, 365 days of the year. We tried an experiment about a year and a half ago to see if there was a need, and just 6 hours a day, we see about 40 to 50 patients a day. So you can see there's a big demand there. In Richmond Hill, we run a number of ambulatory care services. The building to the middle is our mental health area. On the right is another location where we provide dialysis. And then even up in Barrie, we provide acquired brain injury services and autism services. So these locations will continue, and our vision is to create more and more of these locations even as we grow with the hospital. So some quick facts, and what's really important here is just the nature of the growth. So as we go into the second hospital, we will be hiring over 2,000 new staff, frontline providers, physicians, and obviously a whole host of additional volunteers will be needed as we go live with the new hospital. At the same time, we are a very busy place. Over 109,000 emergency visits between the main hospital and the urgent care center. And one of the challenges we face, and you'll see more of this, is just the sheer capacity. So if you've been to the Mackenzie Richmond Hill Hospital, you've been to the Emerge in the last couple of years, we've actually had to take a big piece of real estate away from the waiting area to create more treatment spaces. It's just a reality of what we're facing. That emergency department was designed for a maximum of 80,000 patients a year, and we're seeing over 100,000 today. So it is a challenge, and we will continue to be pressed for space and capacity until the Vaughan Hospital comes online. We currently operate 515 beds at the Richmond Hill site, And as we grow to Vaughan, it will be built for 350 immediately, but it has the capacity to go to over 500 beds. So this is an important slide. It describes the services between both hospitals, and it really does build on the business case that we submitted early in 2010 to justify the second hospital. When we looked at the demographics and the growth, we fundamentally felt that both communities, Richmond Hill and Vaughan, needed full-service hospitals. And what that means is a 24/7 emergency department. And when you have a 24/7 emergency department, then you need a whole host of other services to support that critical program. So you need critical care beds, ICU beds, you need medical and surgical beds, you need operating rooms, you need diagnostic services like MRIs, CTs, labs. So both hospitals will have what is defined in the bottom as an acute care full-service hospital. At the same time, the hospitals are fairly close together. They're about 8.5 kilometers apart along Major Mackenzie Drive. It did not make sense to duplicate a bunch of services when the hospitals were that close, and actually split them so that we could provide the kind of subspecialty, specialized care that you have to go downtown to receive. So I'll give you an example. So obstetrics, stroke, pediatrics, and mental health will be located in Vaughan. And what's important here is that if we did 2 obstetrics units, one in Richmond and one in Vaughan, we do about 2,000 deliveries on each site. We'd never be able to track the physicians who work at a place like Mount Sinai or Sunnybrook, who deliver very high-risk babies and deal with mothers who have medical conditions. They're called maternal fetal medicine obstetricians. They would never locate their practice with 2 small centers. If you combine them to 1 unit with 4,000 deliveries, then they can see some high-risk deliveries. And what that means is people don't have to go to the 416 to receive what we would define as specialized or tertiary care. The same thing can be said in Richmond Hill, for example, for rehabilitation. So rehabilitation requires a type of physician called a physiatrist. Again, they would not locate their practices and support a hospital without a critical mass of beds. So what this means is that we will have better care, more specialized care, and it will be closer to home, although it will be split between the 2 sites. What's also important is wherever you arrive, either hospital, it's one door. So if you do need to be transferred, that will be coordinated. In most cases, you won't have to be transferred. We can deal with most things right in the main hospital. So 550 beds capacity in Richmond Hill. The new Vaughan Hospital has 350 beds, but we can go up to 550 beds. So we've been able, and Sue will speak to this, convince the government to shell in a number of floors. So we're building those floors now so that we have room to grow and eventually open all those beds. So we don't have to build again. Those beds and that capacity are there. So this slide just talks about the earlier comment I made around the pressures that we face. So on any given day, the main emerge in Richmond Hill will see between 250 and 320 patients in one single day. We will see anywhere between 45 and 70 ambulances a day in that hospital. And we've seen a huge amount of growth, 38% growth in that traffic in the last 4 years. So you can see it's really, really tough. And the one request I make of you is if you do come to that hospital and you're waiting a while for service, just understand the reason behind that is just there isn't enough capacity. So we're doing our best. The staff are working as hard as they possibly can, but it's just challenging until obviously the new Vaughan Hospital opens. When we open the second hospital, we can, at a minimum, do 154,000 visits between the 2. In fact, we can do a lot more. There's more than ample capacity to meet the growing needs of both communities. So, Marilyn knows this slide. I've been showing this slide since I started here, and I started in 2010, so we were in stage 1. And we've been moving along this, although some people said, no, it's never going to happen, it's never going to happen. Well, we're now in stage 5. So stage 1 was the original business case, convincing the government that they need to make this investment. Stage 2 was the actual specifications of the functional program, so the kinds of rooms, the kinds of spaces, the kinds of services. Then we actually did the specifications to go to tender. We went through what is called procurement and tendering process. We have selected Plenary Health as the preferred proponent, now the proponent. And we are now into construction. So in many ways, 5 to 6 years to get through these stages is actually quite quick. I know, and I'm a resident of Woodbridge for the last 13 years, I know a hospital's been promised for decades. but we didn't actually start till 2010. So it's important to realize that we've actually gone fairly quickly. The top slide talks about the process with Infrastructure Ontario that supports the delivery of big infrastructure projects. So they help us in the pre-transaction, but ultimately in the implementation of this project. So the project will be completed in 2020. In the summer of 2020, we will achieve substantial completion, and we are planning to open the hospital by the end of that calendar year. The grant from the province for this project, $1.3 billion. The total project value is about $1.6 billion. And the balance between the 1.3 and the 1.6 is where the local share plan, the foundation, and other supports comes into play. The funding from the region as well. Over $100 million from the region supports that difference. So now we're going to show, I believe, a video.
The new Mackenzie Vaughan Hospital, Canada's first smart hospital, is part of Mackenzie Health's two-hospital model that is designed to serve the diverse and growing community of Vaughan and York Region. At Major Mackenzie Drive and Jane Street, and 8 kilometers west of Mackenzie Richmond Hill Hospital, a generous canopy reaches forward to create a clear sense of destination and welcome. Entering the Vic Design Family Welcome Center and main lobby, the double-height space is filled with daylight and warm natural materials. A feature stair is set against a large, multi-story glazed wall overlooking the main courtyard. Generous drop-off areas provide ample space for vehicles and pedestrians. The Magna Emergency, Woman Child, and the West Public entrance are all clearly delineated destinations. Navigation to the parking structure is easy with direct access to a south-facing glazed linkway that connects to the hospital within a terraced garden, emphasizing the importance of landscape as a calming and restorative environment. Visitors entering from the parking linkway can proceed straight up the stairs or ahead to the public elevators to amenities such as a retail pharmacy on the main street on level 1. The library's prominent location reinforces the hospital's important role in health education. The cafeteria below, bathed in natural light, opens up to the main floor, bringing a sense of vitality to the main street. Interior and exterior spaces are uniquely woven together. Welcome desk, registration, and the main public elevators are straight ahead and visible upon entering the hospital, making wayfinding simple and clear. Visitors have orienting views to the outside at each public elevator lobby, a key component of intuitive wayfinding. Inpatient rooms are efficiently organized with communication stations nearby, ensuring that staff are readily accessible to their patients. Designed with the needs of patients and families in mind, natural wood accent materials bring a sense of home. Privacy for the patient is always considered. Large windows provide expansive views to the outside. Continuing improvement of healthcare delivery is exemplified with the distinctly prominent location of the Learning and Development Pavilion. Expected to be complete in 2020, the Mackenzie Vaughan Hospital will create 1,000 new construction jobs and will require an additional 1,800 staff and 100 new physicians to provide care when it opens its doors in late 2020. The new Mackenzie Vaughan Hospital is state-of-the-art, designed through the eyes of the patient, connected to nature, and enabled by smart technology to meet the needs of the fast-growing community of Vaughan and York Region. As part of an integrated two-hospital model, including the Mackenzie Richmond Hill Hospital, Urgent Care Centre, and numerous community-based programs, Mackenzie Vaughan Hospital will provide seamless and exceptional care for patients and families close to home.
So, just about 4 weeks ago, we had a very significant moment for this project, the official groundbreaking and the start of construction. And obviously you can see a number of dignitaries that were present for this event. What's very important about this groundbreaking is it was not the first groundbreaking. We had the benefit working with the city and the province to do work ahead of time. So the city, who are the owners of the 82-acre parcel, we have a 99-year ground lease with the city. We worked together about 2 years ago and we started all of the infrastructure work that in effect has saved us about a year and a half. So this could have been done as part of the construction of the hospital. In fact, we worked together and we saved a year and a half by doing this before we awarded the contract for the new build. So the sewers, the roads, everything is ready, just like you would see in a subdivision. All that infrastructure is now in place, which saves us time, and obviously that collaboration was key in that. I have one more slide, and then I will come back after Hafiz and Stuart speak about the project and some of the design, and speak about the smart component. But I wanted to share this slide because in the end, this amazing building, which it is just a building. It is the people that deliver the care that will make the difference. And we know that we can always do better in terms of how our staff interface with patients and families. And what you see here is a lot of some of those elements going into designing this hospital. Whether it's the patient's needs, we involve a lot of patients in the planning of this facility. Whether it's the community engagement sessions like today, lessons learned from other hospitals like Humber and Oakville that have gone before us. The standards and the principles have been key. So as an example, one of the things that we did as the bidders who were competing for this job, we put them through a challenge. They had 4 different phases of design development. We would give them an actual patient care scenario. So the last one I think that they had to address was an adolescent mental health patient coming to the hospital, the emergency department with York Region Police, with their family in a car following the police. And the designers had to talk about the entire episode of care, the entire patient and family experience, from the triage and emerge, to the actual treatment in the emerge, to the transfer to the inpatient unit, where the family would be, describe all the spaces to make it a patient and family-centered environment. And it really, I think, challenged the teams to understand that first and foremost, this is a hospital about patients and families, and in the end, with all of the technology that you'll hear me speak about, the root of how we deliver great care is people caring about people. So we have to find ways where people can spend more time with one another, as opposed to having technology as a barrier, which in many cases it does become. So I just wanted to kind of lay that out as a fundamental principle in delivering excellent care. So with that, I'm going to turn it over to Hafiz to tell you a little bit about the project team.
Thank you, Thank you. Thank you, Councillor, and everyone for coming. I just want to express how grateful and thankful we are to be selected to be part of this project. It's a wonderful project, like Alta mentioned, to be part of, and our team worked really hard to get to this stage. But it is only the beginning, and so I'll explain to you who our team's made up of before I hand over to Stuart, who will talk a little bit about the design. So for those of you that don't know, so I'm vis-a-vis with Plenary Health, and we are a specialized alternative finance
Could you speak closer to the mic?
Sure, I can. Is that better? All right. So my name is vis-a-vis. I'm with Plenary Health. We're a specialized AFP developer, so we exclusively develop only alternative finance procurement projects in Canada, in the States, and in Australia as well. We've been in Canada since 2005. I'll talk a little bit about some of our projects and our experience. And we responded with our collective team to the specifications put out by the hospital. So just to briefly introduce you to our team, the design and build team is led by PCL. They're Canada's biggest construction contractor. They've done a number of AFP projects and a number of hospitals, both through this model and outside of it. And the lead architect is Stantec. So together they'll lead the entire design build team. We've put up a couple of other key members of that team. So the mechanical subcontractor is Modern Niagara, the electrical is Planning Group. And we highlight them because a hospital is a pretty intensive building, and those two subcontractors form a large part of the team in terms of assisting in the design and the delivery. And some of the key consultants are Intuitive from a structural consultant point of view, and WSP and then group for mechanical, electrical, and other civil disciplines. This model, as you might be aware, is a long-term model, so not only do we build the facility, but we operate it. So our operating partner is Johnson Controls for this project. And Plenary is an active project manager. So myself, I was on the pursuit team. I will remain involved during the construction phase, and our operations team, which I will oversee, will be responsible for managing our service provider for the 30-year duration. And Plenary is a developer that doesn't sell its assets or its investment. We have not sold our stake in any project. We stay involved as active managers throughout the life of the project. I won't get too much into the financing of it, but it is a key component of this model of delivery. And to keep us incentivized for the long term, we are the equity sponsor along with PCL, who's an equity sponsor for the construction term, but we stay on for the duration. And TD Bank, who everyone recognizes, and the last one is the Alberta Treasury Bank. Long story about how they're involved, but they're part of the lending team for the project. And then two partners that were brought to the table for us, which are effectively part of our team now, were selected by Mackenzie Health, and we'll talk a little bit about it, so I won't get into too much detail. But the managed equipment service provider is Philips, and the managed information service provider for all the IT components is a firm called Compugen. So this is a bit new for us, where Mackenzie decided who they want, the terms under which they wanted them to provide that service for the short term and long term, and it was wrapped into our contract. So we own the risk of the total delivery of the project, so there's no finger pointing at the end. But the scope and service of the firms were selected by Mackenzie for their long-term interests in the project. So just to highlight some of our projects in Ontario. So we've limited it to Ontario, but we do have quite a few out west. So these are projects in operation. So they're built and then they're running. North Bay Regional Health Center was one of our first projects. It hit completion in 2009. Bridgepoint Hospital was completed in 2013. Niagara in 2012, and I was actually personally on that project from start to finish. St. Joe's Healthcare Hamilton, I believe, 2014. Peel Memorial, that one just hit substantial completion last 2 weeks ago. So no patients in there yet. The hospital is transitioning their patients in there. And Humber River Hospital, again, one that I was involved with, hit substantial completion last year, and they moved in their patients last year as well. And one project under construction in Ontario, and that's Milton District Hospital, again, one that I was pursuing for and involved in during the construction phase. And that's scheduled for completion in April, and the patients will move in later in the fall of next year. So yeah, I'll hand it over to Stuart and happy to answer any questions afterwards.
Okay, my name is Stuart Elgee. I'm with Stantec Architecture, and I'm the overall design team lead. We've been involved in a lot of large healthcare projects. We've got an extensive background in that, and this type of project is something that we really, it's really at the core of our business, and it's really part of who we are. This type of social infrastructure we think is very important. And as Altaf spoke a little bit earlier about the fact that a hospital is for people. It's about people getting better. It's about people, staff being able to help the community. It's about family, and it's about the people that will use and interact with the hospital. And so ultimately, at the core of any one of our design decisions, we have to think about that. And as Altaf had pointed out, we had a number of these types of sort of scenarios that we had to think about as we were designing and present them to the hospital. And so that was a really valuable exercise. So, what does a stand with birch trees have to do with a hospital? Well, about 30 years ago, a well-known medical researcher found that patients who were in patient rooms and were exposed, had a window and were exposed to landscape and nature, generally got better faster than the ones that didn't have a view. So that connection to landscape and to nature is very, very important, and I'm going to go through a number of the images that you will have seen in the video, but hopefully you'll see that theme running through. And then as we move to a circuit board, well, that's about the enabling technology, right? That's about, and I'll come back and talk a little bit more about technology and how it will really help and improve Mackenzie Health's ability to be able to serve the public and provide better healthcare delivery. But the point of this is that it has been very much considered within our design process. Okay, so this is a site plan, and just for a little bit of orientation, I don't know if I've got a pointer, yes I do. So this is James Street along the right-hand side, and this is Major Mackenzie along the bottom of the page. 400 is actually way over here. And so what we've got, just for orientation, we've got a new signalized intersection right here and over here at James Street. The hospital, it's a little hard to tell because this is actually one of the better images to show. The hospital has green roofs. So all the patients will always, if they're looking out a window, they look out towards a green roof. So it's a landscaped roof. And the hospital is actually right here in the middle of the site. There's a central utility plant that we've pulled as close as we can to the hospital and just away from the residential neighborhood to the north. And the red boxes represent the opportunity for future growth of the hospital. So there's an ancillary building that could be located here. There's hospital expansion over here towards the east, expansion planned from the north, potential expansion over here on James Street. The central utility plant could expand. Parking, this is the parking structure, and you saw it in the video, and we'll see some other views of it. But it was located right here, and this is an opportunity for it to double in size if need be. It was located here because we see this as being a primary access into the hospital. It allows people to, if they know where they're going, to immediately go into the parking structure, park their car, and we'll show you the path a little bit later on as to how you get from the parking structure to the hospital. The service access comes predominantly off of James Street, and this was the loading area. So it's very conveniently located, and what that does is it means that truck traffic isn't moving all the way through the site. So it's not interfering with you as you may be accessing the site. And then there's very long-term future expansion opportunity over here. So this is our current work in progress view of the hospital. In terms of materials, there's lots of glass, lots of reflective light material, as well as metal panel. This is a large building. We'll have the capacity of over 500 beds, about 1.2 million square feet. And so one of the things, just thinking about that large building mass, is starting to articulate it with different materials to help break down that mass and make it feel a little bit smaller and more manageable. So this is a diagram that starts to, and it's a little maybe hard to read from that distance, but it starts to break down where the programs are located. It's kind of like a pancake diagram of the hospital. So the emergency level 1, emergency is the primary clinical service on level 1, along with medical imaging. There's ORs immediately above that, critical care units. Level 3 has mechanical space along with the pharmacy and the laboratory. So that was quite deliberately planned because it allows those services to serve up and down the hospital very easily. We have a large woman and child program on level 4, mental health on level 5, and then there are 3 inpatient units on levels 6 through 7 and 8, and there are 2 shelved floors. So that's thinking about that future expansion. And the level 11 is where we have corporate services, administrative areas, and that floor is planned exactly as all of these inpatient floors, so that when the need arises and that demand comes into play, those areas can be moved out into an ancillary building, and then that can be expanded to be another inpatient floor. So that's thinking down the road. This is a view of the main entrance. So as you would come off of a new access into the hospital site off of Major Mackenzie, there's a large canopy that reaches forward, provides cover as you drop off, warm natural materials, part of that canopy, and you will, the front entrance is immediately ahead. Over here is the learning and development program that was identified in the animation. So this is an area where, and it really speaks to Mackenzie's thinking about healthcare delivery. This is an area where they have simulation suites where staff can work on high fidelity mannequins, go through certain drills, and basically upgrade and improve their clinical skills, and also bring in allied health professionals from other hospitals or whatnot, so that they can come in, and this can be a real sort of primary hub of kind of healthcare delivery. And as you would come in the main door, then here's the, it's a 2-story high entrance, double height glazing, to the east, which looks like onto a courtyard, so that's that immediate connection to nature and the landscape. There's a welcome desk right here. Patient registration is directly ahead, and the main public elevators are over here. So everything is, as soon as you come in the front door, you can see where you're going. And then this is a view just looking out towards the east to that courtyard. Okay, so this is what's called a section, and this is the main entrance. So this is you're coming in off of that main entrance. What this shows is it's a slice through the middle of the building, and it shows how we've got this great sort of 2-story high space that has overlook into a cafeteria below and to a courtyard on the other side. And so this is now a cut the other way. So the main entrance is almost like a bridge between these double height spaces. So this is looking into the cafeteria below, and there's an immediate connection to the courtyard over here towards the east, and a seating area. We'll see some other images of that. So you park your car in the parking structure, you take the elevator, you come down to the lowest level, immediately you see you've got daylight and an opportunity for a cafe. You can pick up a coffee on your way to the hospital, and going through a glazed link. So you're in a weather-protected, environmentally controlled link with south-facing, full floor-to-ceiling glass to a cascading garden. So again, there's that idea of you're always feeling like you're within nature and connecting yourself to the landscape. There's opportunities along the way for public rest areas. This is it from the outside, just sort of pulled out. And then as you would come into the hospital, you can either take the stair directly up to the main level, or you can take an elevator up one floor. When you're on the main floor, and this is, you've moved along now a little bit to the east, the library is located right here, the entrance, the main entrance is right here, and you've got a double height space looking into the cafeteria below. Sorry, good point. So there's a unique aspect to this facility. You come in, and there's a fireplace right at the front door, and it's right here. And there's another fireplace immediately below it in the cafeteria. It's all about trying to create a sense, being able to make the hospital feel a little bit more like a friendly place, like a home, and we think that was a great sort of component that Mackenzie put into the output specifications that we responded to, and you'll see that in reality just in a few years, but it'll come. So the video commented that when you take the public elevators anywhere, you immediately, and you come out of the elevator, you always have a view to the south. So this is Wonderland, immediately to the south. That's important, just, this is a big building. How many people have been in a hospital and gotten lost? I'm definitely one. And that idea There's a reception area on every floor to help you find the patient that you may be visiting. Each patient unit has its own reception area. And this is an important image because what it shows is that as you would come into an inpatient unit, you always have a floor-to-ceiling window, again, making that connection to outside and helping to orient people. This is what's known as a team station. There's one in every unit, every pod, and it's been designed very open so that from the staff from any position can see the greatest number of patient doors, so they can always be aware of patients. This is a typical labor birthing recovery room. You see the bassinet right here, lots of window, and there's a family space that has got a little bit more privacy, just kind of tucked away. A typical inpatient room, they all have low windowsills, and that was very deliberately done so that even if you are in bed, you always have the opportunity and the ability to be able to see the ground from your patient bed. Okay, we're stepping out, and this is the view, and this is on the east side, this is the service area. The important aspect of this image is that this is all 1 story below grade. So from the pedestrian level, you really don't get a sense of all that service activity, those waste compactors and all that kind of stuff. It's hidden away from view. And then moving around, now we're on the north side looking towards the south. This is the central utility plant. It even has a green roof, and you can get a sense of the green roofs so that from any one of those patient bedrooms, you're seeing a landscape. We've now moved around to the west. This is the above-grade parking structure, just the corner of it right here. And this is that stair and elevator that you could have taken down. This is that glazed link, which actually goes under the access road and then pops out here. This is all fully glazed, and this is kind of like we call it a cascading garden. So it's allowed, it's that opportunity to be able to provide a really beautiful landscape and full height glazing so that you've got that. And the important thing here was that instead of doing a bridge, we get a view, and this is the emergency. So this is an important view, if you're thinking about you're coming to the hospital, you're going to the emergency, you may have someone that you're needing to drop off quite urgently. You can identify where you're going from way back here. So it just helps in terms of wayfinding. The woman and child entrance is right here, and there's a public entrance right over here. There's a close-up of it, the emerge walk-in entrance, woman and child entrance, and the west public entrance. Back inside, we're at the lowest level. This is the lowest level when you come out of the main public elevators, and this is the view, full-height glass, out to a courtyard that will have public seating adjacent to the cafeteria seating area. The servery is over here to the left. We've moved out into that courtyard, and now we're looking at the stairs that move from the lowest level up to the main floor, from the main floor up to level 2. We've now moved a little bit to the south, and we're looking into that courtyard. So that's where that view was taken. And the main entrance is right here. And then this is back where we started, and where we currently stand with our design resolution. So I should introduce Vaughan from PCL Constructors. So he's going to take you through a little bit of it's called a 4D schedule. It starts to actually demonstrate how the building's going to look as they build it.
Hi, just to repeat, my name is Vaughan. I'm a senior project manager at PCL. This will be my 4th D3 healthcare. My first one being Niagara, followed by Humber, and I just recently completed Bill Memorial. My role will be what we call the operations end of the build. This is a 4D schedule. PCL utilizes these to kind of plan out the construction sequencing, and these are useful for us to figure out What are the major elements that we need to coordinate in order to make this thing happen successfully? This is an early works kind of demonstration showing us starting in early 2017. We're in the middle of doing the early works planning to get equipment on site and begin the works as soon as possible. This is a little further into 2017, and it starts to demonstrate us doing some of the major excavation, foundations, and direction of cranes. And we use that to figure out where to place cranes to maximize it.
Point at Major Mackenzie. Yeah.
That's Major Mac. And our whole project compound will be here, and we just manage the whole project there. Our trades will park here and assemble and build the elements here. This shows it progressing a little further into 2019 as we get through to the top of what we call topping off, and that would be the top slab. And just showing, demonstrating that some of the cranes comes down, some of the elements are in place, some of the street infrastructure is in place, and it's just a progression. These are just kind of little slides out of a bigger 4D schedule. We do it almost by month, and in some cases we do far more detailed analysis by the day and week. And that pretty much shows the end, getting to the end of the project, showing you the major elements finished.
Thank you, Andre. And as you can see, this is pretty real, right? It's a very strong depiction of what you will see as you're driving by Major Mac or going north on Jane. So I wanted now to speak to you a little bit about the technology that's going to go into this new hospital. We're coining the term smart hospital because we really do believe there's an opportunity to introduce technology in a very different way to really create efficiencies. Ultimately, to my earlier point, ensuring that our providers can spend more time with patients. So if you walk through most hospitals today, you'll see the nurses in the hallways charting with their heads down and really not making much eye contact with anybody. That's the nature of the systems we put in place. We've actually got in technology to help in some ways, but also I think it's a hindrance to enabling our providers to be engaging with patients and families. So how are we doing this? So first is an electronic medical record. So we've purchased a new electronic medical record from Epic. This is one of the biggest companies in the world for electronic medical records, and that system will go live in July of 2017. And that system will then also be deployed into the new Mackenzie Vaughan Hospital. So it goes live in Richmond Hill, and it then obviously creates an opportunity for it to also be deployed because we want our records integrated. So in this case, seamless care, no paper. Also, a number of important tools to help patients. So it has an application called MyChart, which really gives the patients, and if you've been to Mackenzie Health, you know we already have a module called MyChart. This is an even more enhanced MyChart tool, which in effect gives you complete control of your care. So you get to see the results, your lab results, your imaging results, the same time the physician would. You get to see the reports. You even get the ability to schedule appointments. You even have the ability to turn on features such as if there's a cancellation, I can get an earlier appointment. So it becomes your tool to manage your care and empowers you to really take control of how care is delivered. On the right-hand side, we have a managed equipment contract with Philips. So this is an 18-year contract. And what it does is it provides all the big technology, both for the Richmond Hill Hospital and the Mackenzie Vaughan Hospital. The reason we chose one partner is to ensure that we continue to optimize the use of technology. So typically what happens now, you buy a piece of equipment, no different than your smartphones, and you're kind of left with it and you're using maybe 20 or 30% of its true potential functionality. In this case, Philips is always there helping us use this technology, the UCT, the UMR, the software that goes with it, and continuing to improve our workflow, improve how we treat patients, and at the same time how we replace equipment. So today, we use our MRIs, our CTs well beyond their useful life because we don't have the funds to pay for it. We have to go on another capital campaign. In this case, we purchased this with an annualized fee for the next 18 years. So when the latest and greatest piece of equipment comes in, they're obligated to switch it out and put it in. The other major lesson we learned from other hospitals was to pick your equipment provider early. So one of the challenges that Stuart will face is some of the components of what goes in that room and how heavy is your MRI, how much heat does it generate. All these things have to be factored into the design. If we can't tell Stuart that now, then he won't know how to design that room. And if we don't tell him, it means we're redesigning or actually renovating. And this has happened to brand new hospitals, renovating space before you even open the hospital because the equipment doesn't fit. So we won't let that happen. That's why we picked Philips as early as we have. And they're sitting at the design table with Stuart to give him the right information. So CompuGen is another contract that we've procured. And this is the group that really creates the smart layer that connects all of the disparate pieces of technology so that they work as one. We've assigned that to PCL so that they can work together to get to substantial completion so that there is one point of accountability, in this case PCL. But then CompuGen works with us for another 15 years, continues to refine what we call smart workflow. So I have an example to help you understand what we really mean by this. So if you came to the Mackenzie Richmond Hill Hospital, and I think some of you are volunteers and work there, you would hear probably 6 to 7 times a day code blue. Code blue is a patient somewhere in the hospital is having a cardiac arrest. In any hospital, there's an assigned code team. They do their day shift. They may be in ICU. They may be on an inpatient unit. But when the code gets called, they drop what they're doing, and they basically grab a cart, and they get to the location where the code was called. The patient may be on meds. The meds have to be stopped. The bed has to be adjusted. A whole host of things have to happen before they can actually start resuscitation. So that's today, and that's 99% of hospitals in Canada. The smart hospital would sort of work like this. There wouldn't be an overhead page. The telemetry system that the patient is hooked to that monitors their heart rate knows that it's a code. It silently contacts the code team on their smartphones or on a paging system. That team, wherever they are in the hospital, they have special RFID tags, radio frequency ID tags on their name badges that can override the building automation system. So now, instead of having to wait for the elevator knows with the building automation system that they're the code team for the day. It automatically gets them into that elevator before anybody else can. At the same time, by the patient, the infusion pump on the right-hand side, the narcotics, certain drugs get stopped automatically because the telemetry system has talked to the pump system saying it's code, stop following drugs. The bed also knows it's a code, automatically lowers and adjusts so that they don't have to move the bed to administer CPR. So these are precious seconds that will save lives and make a difference. So we call this a smart workflow. We will have 75, or we're working for 75 of these different smart workflows to really improve care so that we're providing a greater ability to do what has to happen that much faster. So that's an example. So you may say, wow, this is really nice, pie in the sky, is it really happening? Well, I think Councillor Iafrate and others have toured this unit. We actually have a live unit in the current Richmond Hill site where we're testing some of these technologies today. We call it our innovation unit. So, for example, one thing we've done on that unit, we put the same RFID tags that I talked about onto the staff so we can actually monitor where they're moving around. And it's connected to the hand sanitizer dispenser. So when we wanted to see if people were really washing their hands, we would call them the hand hygiene police. They come around with a clipboard and they just watch people. So when someone's watching, you tend to do what you're supposed to do. You wash your hands more often. So we would get ratings of 80, 90% compliance. With this system, it's automatic. So the badge talks to the hand hygiene station, and when they forget to wash, we know. So what we thought was 95% turned out to be 60%. But they get a report card after each shift, they know how well they've done. So people are competitive, and they know it's good for patient care. So the numbers have gone right back up to 95%. So that's just a simple thing that we're trialing. The smart beds are there, the badges are there. Even mobile phones, we're trying to use that to see if we can improve care. And we've created a separate company called Mackenzie Innovation Institute, so that the companies, the vendors can come in and experiment with their products. And we have one simple rule. We don't care if they develop intellectual property working with us. We don't care if they're able to commercialize it and make lots of money. All we ask is that we're first to market so that we're at the cutting edge of innovation, both at the Richmond Hill Hospital but also at the Regional Hospital. So that's what we mean by SMART. So last slide, I talked about the local share and our fundraising plan. So we have an amazing campaign chaired by Greg Somera called the Exceptional Care Belongs Here campaign. We have a cabinet and a foundation and foundation board that are very actively engaged in this. And again, we need your support to fundraise for this hospital. So again, there's material in the back. You can go on the website. And again, we encourage you to get involved